Hello, very good afternoon, ladies and gentlemen. Here I am, Dr. Udey Vir Gandhi of Dental Avenue, Kolkata, and I'm back again with a very interesting topic of discussion, which is about patient safety in dental clinics. So we will discuss about patient safety as well as we'll discuss about the safety of the staff and the doctor, the dentist himself or herself in dental clinics. And for this discussion, today I have a very interesting person here with me. He is Dr. Nirjhar Chatterjee, who is MBBS, MD in medicine, pharmaceutical, and tropical medicine, working in biotechnology and pharmaceutical medicine for more than 30 years now, and has worked in various companies, to name a few: UCB, GSK, Novartis, so on and so forth. And he's worked in Europe and currently is working in the United States of America. And his primary work today now is pharmacovigilance and patient safety, which is what we are going to discuss vis-a-vis dental clinics. So I welcome Dr. Nirjhar Chatterjee to this conversation today.
Thank you for having me over.
Yes, so Dr. Chatterjee, I'm sure since you are a person who works for safety of drugs in pharma, you also would understand or believe that how important safety of patients and the staff is when they are in a dental setup. And I'm sure you would have visited so many clinics, dental clinics in your life. You would have met so many dentists, and you see that what kind of equipment we have here at Dental Avenue looks a little different from the general. And what do you think? How important it is to have equipment that renders better safety, or for the patients and the staff?
Thank you for asking me, Dr. Gandhi. This is a very important question because usually when you hear the word patient, you're always thinking of patients going to a hospital or a clinic. But nowhere ever thinks about safety of patients in a dental clinic where there are a number of sharp instruments everywhere. So yes, I would like to discuss patient safety in dental clinics with you.
Yeah. So what do you think is like from the time the patient enters the dental clinic, he is entering an arena of radiology. He's so many sharp, as you said, sharp instruments, and we have rotary instruments which run at really high speed. And in any case, when the patient comes to a dentist, he or she is really scared, and they have apprehensive is probably the right word. So I think the kind of equipment that we have is different from the other clinics, and it helps in removing this apprehension from the patients and reassures them that they are safe. So what do you think about the safety features that exist in such chairs, as you would have noticed?
Yeah, absolutely. So the most important feature of a dental clinic, any dental clinic, is the dental chair.
Absolutely. Yeah.
Because that's where you're working and that's where the patient must safely go and sit, because on both arms, there are sharp instruments.
Correct.
So that's where it's very important that the patient and the working staff are fully aware of the safety of the patient when going and sitting on that. So I saw in another clinic, Anthos, I'm not familiar with all the dental chairs, but I believe well-known brands, they have done a lot of research on not only the features of working, but also features on safety.
That's right.
So that's what we can discuss about that.
Yeah. So you would have noticed that the kind of the chair you spoke about, for example, Anthos and chairs of the kind, they are much more expensive than the normal chairs. So it becomes easier for regular dentists or dental clinics to acquire the cheaper ones. But there is a difference. So which is what we want to tell the patients and the people who are watching this, that look, there is a difference when you walk into a clinic which has got equipment which is high end. It's not just about the cosmetic or the look of, but it is more than that. So what is that according to you in dental chairs? What do you think? You would have definitely noticed some differences.
So I would think from the top of my head is R&D, research and development. So these big companies who invest in research and development to get out the best product from a patient safety point of view and also from an ergonomic point of view. So one of the top features that you want from a dental chair is reducing infections. So you need to have the chair which is easily cleanable, not washable, but cleanable with detergents.
Absolutely,
so you can't have crevices and linings where it's not easy to clean. And also, if you're putting upholstery on that, they should be autoclavable, for example.
Yeah.
So basically, reducing chances of infection.
That's right. That's right.
The other feature I would say is, from a chair's point of view, is the mechanical advantages and the electrical equipment. The electrical part, because it's running on electricity, it should be shock-proof. It should not cause harm because you have both water and electricity in the same unit.
Absolutely.
So that's where good companies who have done research and development have looked into it. So they have to change the even the material. So the material that is used in the chairs has to be of approved materials. That means they have to get the certification that these materials are safe for the dental chair.
Yeah.
So that hikes up the price also, because those materials are sometimes not easy to, not available, or they have to do more manipulations to make it safe.
Yeah.
The other thing is the ergonomics. So since the dentist is working on the patient, and the size of the patient differs, and depends on whether you're working on the upper palate or the lower teeth. The patient's positioning has to be changed. So the chair has to be tilted in such a way that the patient is not slipping out of the chair or is not uncomfortable.
Absolutely.
And the patient is afraid because of the equipment and the procedures.
Yes.
So the patient is in a panic, could go into a panic. So what can the dentist do is that the patient doesn't hurt himself or herself.
And is more comfortable.
And is more comfortable in a chair. So that's very important, that the cushioning of the chair is good. The armrests are easily manipulatable so that the patient feels comfortable at the raise. And the headset is also very important.
Extremely important point you have come to, Dr. Chatterjee. The headrest is such an important thing because that's where your head is resting.
Yes.
And in the usual chairs, the normal chairs, I could call them the run-of-the-mill chairs.
Yes.
When you change the position of the chair, the head is not in sync with the rest of the. So it's a jerky movement.
Articulation.
And the head goes suddenly into a different position. So it doesn't make a very pleasant experience for the person who's sitting on the chair.
Yes.
Whereas when you are talking about chairs of the kind which you mentioned, which you noticed we have at Dental Avenue. So those chairs, when the patient is being brought into a different position, the chair is changing its position, the head automatically, the support of head automatically moves without any jerky movement. So it makes very smooth transition of positions. So that is extremely important feature. And you were talking about the infection control. And I think you would also know that the system of water coming into, so there is something known as suckback mechanism.
Yes.
So sometimes the instrument that we use, which are contaminated obviously with blood and saliva. So if by chance that can get sucked back into the line, into the pipes, and if they are not taken care of, they can be transmitted, or cross contamination could happen to the other patient. So this kind of high-end chairs do not allow the backward movement. And there is an auto cleaning that happens in this kind of chairs. So chances of cross contamination, cross infection are absolutely nil.
Absolutely. You're absolutely right. The other feature is the high volume auto suction. The suction is very important so that there is no aerosol contamination. so that there is minimal droplets around the patient
Absolutely.
or around the operator or in the clinic.
Yeah.
So that keeps the contamination contained.
You're very right, and that played a very major role during COVID. Because we have this kind of a chair where all the aerosols can be very easily removed and sucked away from the immediate environment. So we could deliver services, treatment to our patients in a very safe environment.
Absolutely.
So that played a very big role at that time as well.
Exactly. And the other feature, which is, as a dentist, you will know that the LED lighting system, you need to have very good lighting. But the light should be bright, but it should not burn the tissue. The heat
Absolutely, you're bang on, because I know the chairs which come, the regular chairs which we are speaking about, the equipment, the lights are bright. Really extra bright
and hot,
and they can be kind of harmful to the eyes of the patient. Well, you can say the patient is there for 5, 15, 20 minutes, but the operator, the dentist himself or herself, is if they're using that kind of light and looking at objects closely in that light, that could be harmful for the eyes for sure.
Yeah.
So that is definitely not there in
these cells, because when we were kids, we used to use the magnifying glass to burn paper from the sunlight.
So it's almost like burning the tissue.
It focuses.
Yes. It almost harms the tissue, and it's very delicate tissue inside the mouth.
Yes.
Another point you very rightly brought about was this is about the health of the dentist that I'm coming to, shifting from the patient now, that ergonomic position.
Yes.
So the kind of, when we speak of the dental chair, we speak about the doctor's stool as well, which comes as a combo with the chair. So the kind of operator stools that are available with good chairs are the ones that give good support, lumbar support, good back support.
Yeah.
When you can sit for prolonged hours and do long procedures. So they support well enough.
Yes.
So that you don't end up with things like sciatica, and you don't end up with back problems, and especially because we are bending our heads so much into the patient's mouth, looking at the upper jaw.
Yeah.
So that continuous position of the kind can be harmful. What is your view on this?
So absolutely, because the good health is not only for the patient but also for the operator, and also for the assistant who is assisting the doctor. So it's very important that the height control of the chair is electronic, and it should be hydraulic, so that it's smooth operation. And also the base of the chair should be large enough and heavy enough to hold the patient in any position and any weight.
Mm-hmm.
That's also very important. The other thing about ergonomics would be the ergonomics of the patient. The armrest should be very comfortable, especially when the patient is tilted.
Right.
So it doesn't cause any discomfort to the arm of the patient.
Right. Absolutely right. So I think we have heard from Dr. Chatterjee that he firmly believes, and he knows for sure, because that's his job, that it's how important it is to have equipment that is safe for not only the patients, but also safe for all the dentists themselves and their support staff, so that they can be, they can work for as many years they wish to and remain healthy. That's the most important thing, is that the doctors and the support staff remains healthy, and the patients also remain healthy, in the sense that there is no cross-contamination, there is not much of, unpleasant movements and jerky movements, etc. happening. And so the whole environment per se becomes a very ergonomic environment, if I may say, for the sake of the patient. So I think we have in short discussed pretty much about the dental chair, the main operatory, that is operating equipment for the dentist.
Yes.
And soon we'll be back again, and we'll discuss about the other features, other safety measures, and other safety necessities that exist in dental clinics, ladies and gentlemen. So thank you very much, Dr. Chatterjee, for giving us your valuable time.
Thank you.
And hope to see you soon.
See you soon. Thank you.